Hello everyone, and welcome to the second recording of Chapter 21, which covers the cardiovascular system, specifically on blood vessels and circulation. We'll first start reviewing pulmonary circulation. You should be well familiar with this already, but what pulmonary circulation is referring to is how blood flows over to the lungs and then back to the heart. So once we have our deoxygenated blood into our right ventricle, we are then going to go through the pulmonary semilunar valve into the pulmonary trunk, which divides into two pulmonary arteries. So we have one that will flow to our right. So we have one pulmonary artery flowing to our right lung and our one left pulmonary artery traveling to our left lung. Once we get into the lung, when we breathe in air, that brings in the air into the alveoli of the lungs, and surrounding the alveoli or the air sac would be a capillary network that you see here. That is when we are going to pick up oxygen and give off the carbon dioxide we have in our blood to put that into the air sac so we can breathe that out, leaving the good oxygenated blood in the venule end of the capillary bed, and we can then take that oxygenated blood and have it go through our two left pulmonary veins here, bringing it back to our left atrium, and our two right pulmonary veins will do the same, coming from the right side and drain it into the left atrium as well. Now this next section is all on the systemic circulation, specifically on arteries. So this should all be review for you, but I'm still going to record this so that you get a nice little review and confirmation that you do know your arteries well. So coming off of the heart, after we pass the aortic semilunar valve, we have the ascending aorta. The first vessel to be given off from the aorta will be the right coronary artery and the left coronary artery, and these will travel to supply oxygen to the heart muscle itself. Continuing on from the ascending aorta, we reach the aortic arch of the aorta. We can see the branch all the way on the right side would be our brachiocephalic trunk, which yes, it is an artery, but we are going to call this the brachiocephalic trunk. And it bifurcates into two arteries, the right subclavian artery, which would go to our upper extremity, and the right common carotid artery, which will go to serve the head and the neck. Going back down to our arch of the aorta, in the center we have our left common carotid artery, again going to the head and neck, and our left subclavian artery is our last branch going over to our left upper extremity. From there, we continue down the descending aorta. If we are in the thoracic cavity above the diaphragm, then we can call it the thoracic aorta. But if we pass that diaphragm and are in our abdominal cavity, then we would call that the abdominal aorta. And of course, at the level of lumbar vertebrae 4, we are then going to split into the right and left common iliac arteries. So here's a nice little illustration that gives all of the important arteries of the body that come from the branches of the aorta. So let's look at them specifically. Here are the arteries of the head and neck over from the right side aspect. And that means this is our brachiocephalic trunk. From there we bend and we have our right subclavian artery, which after the first rib will become the axillary artery. Remember that we have a couple branches coming off of the subclavian artery. We have our vertebral artery that ascends up through the transverse foramina of the cervical vertebrae, and the other branch we see moves in inferiorly. We have the internal thoracic artery or internal mammary artery. Another branch that comes off that we didn't talk about in class is the thyrocervical trunk. I'm not holding you responsible for this, but just know that that trunk is going to give branches to even more arteries in this region. Now let's look at the other branch off of the brachiocephalic trunk, and that would be our right common carotid artery. This common carotid artery is going to then bifurcate into an internal carotid artery that extends up and eventually will go to supply the brain. And the other bifurcation here off of the common carotid artery would be our external carotid artery, which has many branches that come off to supply the areas of the neck and the face. Next, we have our arteries of the upper limb. We saw that our subclavian arteries were branching off of either the brachiocephalic trunk on the right side or the aortic arch itself on the left side. But we know that this is going to be the same on both sides. So our subclavian artery is going to change its name after passing the first rib and become the axillary artery. The axillary artery gives off many branches, as you can see here, but I'm only holding you responsible for knowing the axillary artery, and at its very last portion here, it is going to change its name to the brachial artery after it passes the inferior border of the teres major muscle. So at this point, it becomes the brachial artery. And as this brachial artery continues on down, it is going to bifurcate into the radial artery, which will course to form the main portion of the deep palmar arch. And the ulnar artery will course to form the superficial palmar arch. Here's another great illustration of how blood is flowing through the arteries of the upper limb and what they supply. Here we can see an illustration showing us the thoracic aorta, and branching off the thoracic aorta we have many other arteries, but the only one I'm holding you responsible for is the posterior intercostal arteries that we saw in lab. Now let's get into the arterial supply in the abdomen. So once we pass the diaphragm, the first structure we need to look for from the descending aorta is the celiac trunk. Remember that we have 3 branches that it gives off. We have the common hepatic artery. We have our left gastric artery, which you'll find sitting in the lesser curvature of the stomach here. And also our splenic artery that is nice and curly, so easy to distinguish, going over to the spleen. If we continue down lower, you might need to reflect the stomach and the pancreas in order to see this, but we will find the singular superior mesenteric artery. Remember that this is going to supply the small intestines and the proximal portion of the colon. This illustration has removed a lot of the viscera of the abdomen, so we can see all of our arteries branching off of the abdominal aorta. So we can see here the celiac trunk, the superior mesenteric artery that we just discussed, and we can see the suprarenal branches over to our adrenal gland. Here are the renal arteries going to supply the kidneys. And as we continue further on down, we can see these smaller branches off to the side, and these would be our gonadal arteries. In a male, we call it testicular artery, and in a female, we call it the ovarian artery. Continuing on down, we can see our singular inferior mesenteric artery that would supply the distal portion of the colon and the rectum. At the level of LV4, we have a bifurcation into the common iliac arteries to go over to the right and left lower extremities and pelvic regions. This is another wonderful illustration that shows us the superior mesenteric artery as well as the inferior mesenteric artery and all of the branches that it gives off. Like I mentioned in lab, we have several branches to go over to the small intestines as well as the large intestines. So they are listed for you here on the side, but I'm not holding you responsible for knowing the specific branches that come off. So middle colic artery, intestinal arteries, right colic artery, and ileocolic artery will not specifically be tested, but you can definitely see them in lab going to the regions of the colon that it does supply. Same thing with our inferior mesenteric artery. You can see all of the branches like the left colic artery, the sigmoidal arteries, that go over to supply the sigmoid colon, and our superior rectal artery that goes to supply the rectum. And this is the wonderful chart that you can go through in order to recognize what each of these arteries supply, as we've mentioned before. Now let's move through the arteries of the pelvis and the lower limb. So we've already mentioned that the descending aorta will continue down to about LV4, where it'll bifurcate into the right and left common iliac arteries. That then, after coursing about 5 centimeters, will branch into an internal iliac artery that will go and supply pelvic structures like the urinary structures and reproductive structures. And the other branch it gives off is the external iliac artery, which will continue deep to the inguinal ligament and change its name to the femoral artery to give supply to the lower limb. That femoral artery will continue down the thigh, course posteriorly, and in the region of the popliteal fossa, so we are now in the posterior knee region, which is called the popliteal fossa, it will become known as the popliteal artery. It will then continue past the knee and split or bifurcate into the anterior tibial artery and the posterior tibial artery. If we continue along the anterior tibial artery and we get to the region of the ankle, it then becomes the dorsalis pedis artery. And this is the one that I mentioned in class, that you can feel for the pulse in this artery and diagnose if someone has peripheral arterial disease. If we follow the posterior tibial artery, you will see that it gives off a branch called the fibular artery that will cascade laterally. Here's a nice posterior view of the leg, and we can see that popliteal artery continuing on down. And as I mentioned in lab, we have the tibial arteries that will course either anterior or posterior to the interosseous membrane that sits between the fibula and the tibia. So the anterior tibial artery, at this view, you could see courses above the interosseous membrane and will sit anterior to it. And here is our posterior tibial artery that is cascading posteriorly. And there's its one branch that it gives off, which is the fibular artery. Here's another great chart that shows you the blood flow of these arteries and what they supply. And that brings us to our systemic circulation of veins. Now, we've already discussed these as well, but if you feel like you are in the mood for a nice vein review, then feel free to continue to listen. So we know that veins are always going to bring blood back to the heart. So remember that we're going to flow kind of in the opposite direction of the arteries that we have just discussed. Major veins that we need to recognize that are bringing blood back to the right atrium would be your coronary sinus, which we will find on the posterior heart, the superior vena cava, which is going to drain areas of the head, neck, thorax, and upper limb, and the inferior vena cava, which drains the abdomen, pelvis, and lower limbs. And we have 3 major types of veins. We have superficial veins, which will sit right beneath the skin. So if you look at the back of your hand or the top of your foot, you will see these veins pretty clearly. And the deep veins will typically course alongside the arteries and will have the same names. And we also have the sinuses that we discussed previously, which we will discuss in the nervous system portion of our courses. But just to give you a little preview of this, we have our superior sagittal sinus that courses above the region of the longitudinal fissure of the brain, sitting between the 2 hemispheres of the brain. We also have the transverse sinus that sits in the periphery of the transverse fissure that divides the cerebellum from the cerebrum. We also have the straight sinus here that is also draining the inferior sagittal sinus that continues on back. And all of these sinuses are going to meet here at the confluence flow through the transverse sinus, and then eventually flow down into the internal jugular vein. That internal jugular vein will then flow down to meet the subclavian vein and drain into the brachiocephalic vein, which will bring it down to the superior vena cava. Here's a nice chart that shows you the flow of venous blood as we move from the head and neck region down back to the heart. Next, let's talk about some veins of the thorax and the right upper limb. Let's first start off talking about the inferior vena cava, which again is draining the abdomen, pelvis, and lower limbs, bringing the blood back to the right atrium. We also have the superior vena cava, which drains blood into the right atrium from our head, neck, thorax, and upper limb. And then we also have this azygous vein. If we look back at our chart, the azygous vein is going to drain blood from the right posterior thoracic wall and thoracic organs. I will show you in the diagram that we also have a hemiazygous and an accessory hemiazygous vein that will drain the left posterior thoracic wall and thoracic organs. So here was our azygous vein on the right side, and then you can see on the left side I have my accessory hemiazygous vein, and sitting a bit more inferiorly would be my hemiazygous vein. And all of these are going to drain together into the superior vena cava to then drain into the right atrium. So next, let's talk about how we are going to drain from the area of the hand all the way back to the heart. So we have our digital veins, which drain into the superficial venous palmar arch, which will drain into the ulnar vein. We also have a deep venous palmar arch, which will drain into the radial vein. And these two veins, the ulnar and radial, will drain into the brachial vein, which carries it to your axillary vein, into your subclavian vein, into your brachiocephalic vein, into the superior vena cava. Now you may have noticed some vein names that we haven't discussed in class just yet, and those are going to be our superficial veins. So first we have the cephalic vein, which sits alongside the lateral aspect of our upper limb. So I'm tracing it out with my arrow right now, and this is going to continue up until it drains into the axillary vein. On the medial side of our upper limb, we have the basilic vein, and this is going to continue on up to drain into the brachial vein, which will then continue to drain into the axillary vein, subclavian vein, and hopefully you remember the rest. The last superficial vein that we need to mention is the median cubital vein, this one that sits between your cephalic vein and the basilic vein. This median cubital vein is the main vein in which we draw blood from. And yet another great chart that shows you the venous drainage of the upper limb back to the heart. Now to discuss our veins of the abdomen. Most of them are going to be similar to the way the arteries were arranged, but we will have some differences. So first thing I want to draw your attention to are these hepatic veins. Remember that when we had our discussion on portal veins, these hepatic veins are going to carry the deoxygenated blood that is not nutrient rich into the inferior vena cava to go back into the heart. So we also have this very large vein here, the inferior vena cava. So this would be sitting alongside the aorta, but we of course are draining our deoxygenated blood back to the right atrium. We can also see our renal veins draining the kidneys. We see our suprarenal veins draining the adrenal glands. We also see our gonadal veins. So notice how this right gonadal vein is draining directly into the inferior vena cava, but on the left side, this gonadal vein is draining into the left renal vein, which then will drain into the inferior vena cava. So a little bit of a difference there. The other thing we can notice down here is that our veins are arranged similar to the arteries. So we will have the external iliac vein draining up toward the common iliac vein, and our internal iliac vein is draining up into the common iliac vein as well. The two common iliac veins then drain into the inferior vena cava. Here's another great illustration of the hepatic portal system. We could see our superior mesenteric vein draining the small intestines and proximal portion of the colon into our hepatic portal vein. The inferior mesenteric vein draining into the splenic vein, which will carry the blood into the hepatic portal vein as well. That hepatic portal vein then takes it over to the liver, where we meet our second capillary bed. We are going to detoxify and make use of the nutrients, and then all of our deoxygenated blood will go into our hepatic veins here and drain into the inferior vena cava to be taken back to the heart. By sending blood over to the liver first and not directly into the inferior vena cava, we're able to maintain glucose hemostasis and detoxify some of the blood and make use of other nutrients. We also have some other portal systems in place, one of them being in the kidney, which we call the renal portal, and we also have one for the pituitary gland. We would call it the hypophyseal portal. So if you want to sound smart in front of your friends, just throw that term. And we are going to touch upon these in our urinary system and endocrine system. And yet another great illustration showing you these veins and how they are connected to drain into our liver and picked up by the hepatic veins to go into the inferior vena cava. This is a nice chart that summarizes all the veins found in the abdomen and pelvis, what they are draining, and how they travel back to the heart. Last, we are going to discuss the veins of the lower limb. We'll start distally. You could see that we have our dorsal venous arch that I mentioned to some of you in lab. If you are barefoot and look at the top of your foot, you should be able to see this dorsal venous arch. We'll first start discussing the deeper veins. So we are going to drain into the dorsalis pedis vein, which will then drain into the anterior tibial vein. We can also drain into the posterior tibial vein, which isn't pictured too well here, but a little faded in the back, but that can continue on up, and those two meet at the popliteal vein, which carries it into the femoral vein, which carries it up to the external iliac vein, carrying it back to the common iliac vein and into the inferior vena cava. We have two superficial veins to know here. We have our great saphenous vein or greater saphenous vein, and that comes off of the medial side of the dorsal venous arch, courses up the medial side of our lower limb, and will drain into the femoral vein. Now we need to look at a posterior view in order to see our other superficial vein. Here's our posterior view of the leg, and from this view we can see our small saphenous or lesser saphenous vein, and this is coming off of the lateral side of that dorsal venous arch, courses posterior to that lateral malleolus, and ascends up the posterior leg and will eventually drain into the popliteal vein. And here's our nice chart summarizing the veins of the lower limb.